Imagine this. You're in excruciating pain. I mean, off the charts, can't think straight pain. But every doctor, every test, every single scan comes back clean. Nothing's broken. There's no infection. There's nothing. So today we're going to dive into a medical mystery where the body is screaming in agony, but the usual rule book for what causes pain just gets tossed right out the window.
So our story starts right here, with an 18-year-old woman. And when she says her pain is a 10 out of 10, she means it. We're talking about the kind of pain where even the slightest touch, like a bedsheet brushing against your skin, feels absolutely agonizing.
And it gets weirder. It wasn't just the pain. Her entire forearm and hand were swollen up. Her skin had this strange, mottled, discolored look. And get this, when they took the temperature, her sore arm was a full 3 degrees Celsius colder than her other arm. The craziest part? It all just happened. Out of the blue, no injury, no accident, not a single thing she could point to as the cause.
So you can just imagine what the doctors were thinking, right? You've got someone in front of you who is clearly suffering, with physical signs you can literally see and measure. But all the usual culprits, a fracture, an infection, you name it, they're all missing in action. It's a real head-scratcher.
Okay, so the first thing you do is run the tests. You've got to find a logical reason for what's going on. But this is where the mystery just gets deeper and deeper, because what they didn't find was almost more important than what they did. Just look at this chart. These are all the go-to blood tests. They're looking for signs of infection, inflammation, blood clots, the standard stuff. And as you can see, every single one came back normal. All the flags that should have gone up if there was some underlying disease were just not there. At this point, you're probably thinking, okay, if it's not in the blood, maybe it's something structural. So they bring out the big guns, x-rays, ultrasounds to check her blood flow, even super detailed MRIs of her entire arm, neck, the whole shebang. The result? Absolutely nothing. Not a pinched nerve, not a hairline fracture, not a single thing out of place. Every test was just another dead end. And this is where things take a turn. When all the fancy tests and machines come up empty, a good doctor has to go back to basics. They have to rely on their own eyes and ears, on observing the patient, and on piecing together all the clues that the technology just couldn't see.
And all those clues pointed to one diagnosis: complex regional pain syndrome, or CRPS. Now, the key phrase in that whole definition is disproportionate to any initial injury. This means the pain is way, way out of whack with whatever started it, if anything started it at all. The nervous system itself has basically gone haywire, and the pain becomes the disease.
So, if you can't use a blood test or an MRI, how in the world do you diagnose this? Well, you use a checklist. For CRPS, the gold standard is called the Budapest criteria. Doctors look for symptoms in 4 main buckets. You've got sensory, which is that extreme sensitivity to touch she had. Then there's vasovator, which explains the weird skin color and temperature changes. Next is pseudomotor/edema, which covers swelling. And finally, you have motor/trophic, which is all about weakness, stiffness, and even changes to hair and nails.
And our 18-year-old patient? She ticked every single box. Her symptoms were a perfect match. So despite all those normal tests, they finally had their answer. It was CRPS. Case closed, mystery solved. Right? Well, maybe not. Because just when you think you've figured out the rules for a pain syndrome, a case comes along that seems to throw the entire rulebook out the window. So get ready for a real paradox. Let's switch gears and talk about a 32-year-old soldier. He was near a mine explosion, but miraculously, he wasn't hit by any shrapnel. He walked away from it. But a few weeks later, some really strange things started happening to his leg. Now, let's put these two people side by side. The young woman had severe pain, swelling, discoloration, and motor issues. Now look at the soldier. He's got the swelling. He's got the discoloration. His leg is colder. He's got the weakness in his foot. It looks identical until you look at that very top row. The one massive glaring difference that changes everything. He had absolutely no pain. Zero.
So let that sink in for a second. This guy shows up with what, for all the world, looks like a textbook case of CRPS. He has the swelling, the bluish skin, the cold limb, the foot weakness. He has all the physical signs, except for the one thing that's right there in the name of the syndrome, the pain. It's just not there.
And you might think, okay, this has to be a 1 in a million fluke. But it's not. Turns out, a big study of over 800 CRPS patients, way back in 1993, found that 7% of them also reported no pain.
This phenomenon has been hiding in the data for decades. A small, but very real, group of people get the syndrome without the pain.
So where does this leave us? I mean, if a condition that we literally call a pain syndrome can show up without any pain, it really forces us to stop and ask some pretty big questions about how we even define these diseases in the first place.
And here's the clinical dilemma. Remember those Budapest criteria? Well, rule number 1, the absolute non-negotiable ticket to even be considered for a CRPS diagnosis is continuing pain. The soldier's case doesn't just bend that rule, it completely shatters it. So according to the official rulebook, he can't have CRPS, even though he has everything else.
This problem is so real that some researchers are actually proposing we create a whole new category. They're suggesting we call it complex regional painless syndrome. It's basically them saying, look, something is clearly going on here and our old definitions just aren't cutting it anymore.
And really, this is the mind-bending takeaway from all this. It suggests that all the different parts of CRPS, the pain signals, the systems controlling blood flow and temperature, the motor control, they might not be a package deal. It seems like the circuits in our body that control swelling and movement can go haywire all on their own, totally separate from the circuits that tell our brain, ouch, this hurts.
And that leaves us with one last massive question to think about. If a pain syndrome can exist without pain, then what are we fundamentally misunderstanding about pain itself? It forces us to wonder, is pain just a symptom, or is it something much, much more complex? And if we're wrong about this, what else about the human body might we have completely backwards?